Doctor, also along with that, suddenly I remembered something. Do you think, problem when it comes to sexual difficulties, problem
Sorry.
when it comes to sexual difficulties or,
Uh-huh.
lack of consummating a marriage, do you
Uh,
think, atypical masturbation or problematic masturbatory techniques in men can also lead to erectile dysfunction?
well, I would say that if at all, three things. Masturbation, I will not ask first, do you masturbate?
Okay.
I will ask him, when did you masturbate last?
Okay.
Open ending question रखने का.
Okay.
How do you masturbate? Suppose if he says, my movements are just rubbing or side to side movement,
Huh.
which there are some people who do by just rolling over,
Yeah.
then the prognosis may be good, may not be good.
Good.
But if he's doing with to and fro movement,
Huh.
my prognosis would be good.
Yeah. Correct.
Because it's like mimicking. If you know Hindi, you can teach Marathi well, faster.
Correct.
Second, if a person comes and tells doctor, I don't fantasize, what type of fantasies? With what fantasy you do?
Yeah.
Suppose if he says with a boy, that means he's a gay. If he says with a hair, I would clinch the diagnosis of a fetish.
Correct.
Or if he says, I don't fantasize at all, doctor.
Yeah.
That means I am dealing with a serious case of a thought disorder, most probably a very patient with a very psychotic illness, probably schizophrenia, where he is unable, listen to me, where he is unable to train his neurological system to teach it to respond, where there is a thought disorder. He is unable to fantasize, unable to think about the story. The thought gets distorted. Thought disorder means schizophrenia, 295.
Okay.
So my history taking in masturbation would be very, very useful to me, and my prognosis would depend upon the way he masturbates, the fantasies he masturbates, and how often he masturbates.
Correct. Absolutely.
Now, this questions which you are asking, you ask this to 100 sexologists or urologists or psychiatrists.
They will not.
It's not only experience, but a scientific experience.
Absolutely, doctor. In fact, now I would like to share something, if you have time, about my personal life and the reason why I turned to sexual health and bringing about awareness in this country. Doctor, I married at a very young age, around 23. I married to my classmate. I did my journalism from Asian College of Journalism in Chennai. And after that, I married my classmate who was also a journalist. We went through a sexless, unconsummated marriage for around 4 years.
I see.
Yeah, and I went from pillar to post. Every doctors I consulted trying to identify the root cause of the problem, because I was a very active person in school, college. I was a sports guy. I never used to smoke. I never used to drink heavily. I was a very social drinker. I was physically very fit. So I could never believe that there is something wrong with me. Even doctors couldn't find any problem with me. They did all kinds of diagnosis. They said that physically, they couldn't, even neurologists told me I don't have any physical problems. It's all in the mind. And but even then I couldn't perform in bed, I was happy.
You can, even if it's in the mind, you show me the way, solve the problem.
Exactly. That was not happening. So
I'll tell you that subjects of psychopathology and psychophysiology of sex and sex dysfunctions are not taught to medical students at all.
Yes, and that reflects in the in the answers of the doctors in our country, because but they will never admit their ignorance. The problem is they
would end up writing a plethora of the drug or dope or the so-called sex tonic, which is at all effective only by the well-known mechanism of suggestion or faith cure.
Exactly. And in fact, I was even subjected to a 9-hour investigation by a doctor who is a psychiatrist from sexologist in Kerala. And he, at the end of the 9-hour investigation, which we subjected me through some procedure called abreaction and gestalt therapy and all those things. And eventually he was telling me the next day that I am gay, I am homosexual, and that is the reason why I am unable to consummate marriage. I was so, anyway, and the thing is,
Amused.
yeah, if I was gay, I would not have come to the doctor in the first place. Why would I?
Why should you come? साले घर पागल है.
So this is a qualified doctor with with degrees from US, UK, and all big stuff. And that
अरे
thing,
कुछ नहीं.
and
Remember, even US also, donkeys are found not only in Kabul, they
correct.
are all over. They are in
True,
Chennai,
true,
Mumbai,
true, true, true.
US.
So, doctor, I didn't complete my story. So, I was going through this series of failures. I was having a miserable life. I was doing very well in my profession, though, but
हाँ.
this was affecting my life completely. So,
Right, right.
and I started blaming my wife, and our marriage fizzled off. Okay, which ended up in divorce. Then, after the divorce, luckily a friend of mine who was in the US, he forwarded me a research done by a noted sex therapist there called Dr. Lawrence I. Sank, which was published in the Journal of Sex and Marital Therapy in 1998. So the research is called traumatic masturbatory syndrome. That is about a section, that is according to his research, about 10% of the men, he didn't specify any percentage, but the thing was that a percentage of men who masturbate exclusively in the prone, that is face down position, over a period of long years will have difficulty sustaining erection. And in my case, ever since my age of 9, I have masturbated only in the prone position, and that too with a flaccid penis.
Mhm.
Okay, and that I couldn't even attain erection. Whenever I try to have sexual intercourse, I used to try to apply pressure on my penis and try to work out an erection, but it will never last because it was not conducive for hand stimulation. The moment my partner touches my penis, it will shrink because it was not responding. So,
Mhm.
and I eventually had to learn how to masturbate the right way with my hand.
Right.
That
But
is,
once if you learn that way, then the prognosis would turn out to be very good.
yes, correct. So this basic information I had to read from a research done by a doctor in the US. Sent to me, forwarded to me by my friend. So if that information I had a few years later, I could have saved my marriage. But none of the doctors in India had.
No, but even between you and me,
Huh?
the basic treatment program
Huh?
initially includes masturbation to the point of orgasm
Okay.
in the to and fro manner. So
Correct.
that is a part of it. I don't know why people didn't tell you that.
None of the
Well,
doctors.
it is not necessary to read all the research papers, but the treatment program initial stages include successful masturbation in to and fro manner, and then go ahead with the vaginal penetration because that's also to and fro
Yeah,
movement.
yeah, this the word which you use, to and fro. None of
Yeah,
the doctors asked. That is the key.
but
They
that's what
they
I'm telling
uh,
you. That you don't tell me, but I don't want to speak adverse about my own community.
but it's a fact. Doctor, I decided to start this platform called VVox, which is named after Vatsayan, based on my experience. And I, in fact, got this doctor who helped me get over this crisis, Dr. Sank, as a part of this team. Because I wanted to bring a kind of awareness and bring about some kind of change in my
Yes,
own
yes,
little way.
right.
Because just a simple information could have changed. A doctor like that is why that is what makes a doctor like Dr. Prakash Kothari so
अरे नहीं
distinct.
नहीं
No,
नहीं
doctor,
ऐसा
I'm telling you. See, the fact that you told me that to and fro hand movement, none of the doctors ever asked me. If they had asked me a simple question,
no,
how do you
because
masturbate?
between you and me, they don't know. They talk in the conferences. They talk on the mic with the tie, etc.
Correct.
कुछ भी नहीं आता है साले को कुछ भी नहीं आता है and sometimes I'm amused that they have got some students who are doing PhD under there. क्या करेगा साला student PhD क्या करेगा God only knows.
Seriously, doctor. I don't know. India needs doctors like Prakash Kothari, but
नहीं नहीं
it's not. No, it's,
नहीं नहीं
see,
you know between you and me there has to be an intention to help the individual.
correct.
then you can always, if there is a way, I mean,